Hi there, Dr. Brian Prax today talking to you about the story of inflammation. Current research from UVA, from everywhere really, is talking about how important inflammation is really for almost all conditions. But today we're going to be talking about inflammation regarding peripheral neuropathy. And I have a perfect story for you because I want to let you know that inflammation, or the inflammatory process, is a normal process, especially in an acute inflammatory situation like a twisted ankle. You twist your ankle, inflammation occurs, all of these exudates come in there, and it's the body's immune system's way of cleaning up all the garbage and getting this thing healed. What about a bee sting? What a perfect opportunity. I don't know if you can see the color of this right here or not, but that is an inflamed rash. I got stung right there. And I don't know if you can see how red that is or feel how hot that is, but that is really hot, it's really itchy, and it's really inflamed. I have a little bit of a sensitivity to it, but that is really bothering me. When that bee stung, it hurt. Well, it put a little neurotoxic in there, a little neurotoxic chemical in there that my body responded to, and it's painful. It actually killed some tissues in there, did some damage in there. So what does my body do in response? It creates the inflammatory process, of course. So in an acute situation like a bee sting, like a twisted ankle, a whiplash injury or something like that, the inflammatory process is totally normal. It happens all the time. You get a slap across the face, you get somebody pulling your hair, anything like that, inflammation will occur. Totally normal. It's chronic, long-standing inflammation that's the problem. And with your peripheral neuropathy, that long-standing inflammation, that's what's killing the nerves at the fingertips, at the toes. It starts far out, way at the tips, way at the toes, and then it begins working its way on up, destroying nerves, destroying vascularities, arteries, veins, venules. All of these get destroyed from the inflammatory process. The number one cause of this inflammation is actually preventable. It's a four-letter word, and it's called diet. It's from the food that you are eating. So what we do in our neuropathy program is we teach folks like you how to eat, what to eat, when to eat, how often to eat, and most importantly, what not to eat. Because what we've discovered here is that the standard American diet, we've talked about this before, that's abbreviated SAD, SAD. The standard American diet is a very, very sad situation. And it's the standard American diet that's leading to obesity, that's leading to people being overweight. Over 66%, and now climbing into the 70% of Americans are obese or overweight. And there are now more obese people than there are overweight people. Now you might be thinking, well, I'm slender, I'm skinny, I'm fine. Yes, but if you are constantly eating the wrong foods, then I'm telling you, you're creating an inflammatory process, and it may not affect you today, it may not affect you tomorrow, or it might be really, really bad in the feet and the hands. And if it's affecting you in the feet and the hands, guess what? This is a systemic problem, meaning that it's affecting your whole body. These problems can affect the retina. It can affect the kidneys. It can affect the liver, the colon. It can show up in so many different places. So regarding inflammation, that's the name of the game here. We've got to figure out how to reduce the inflammation, and we know exactly how to do it. It's by looking at your diet. But unlike what you may have heard, or a pamphlet that you read, or your doctor saying, well, watch your diet, we're not just going to say watch your diet, throw a pamphlet your way. We're going to talk you through it. We're going to walk you through it. We're going to teach you exactly how to reduce this diet, and it's called an anti-inflammatory diet. Our program specifically is called the Metabolic Repair Program. It comes with a few supplements that our patients take, but most importantly, together with a very good, clean, and anti-inflammatory diet. And with our neuropathy program, I would have to say that this diet portion, if that's what you need, and not everybody needs it. We have some people that are coming in on a really super clean diet. If you are one of those, you don't need to clean up your diet. But if you're like most of my patients who come in, we are going to need to take a look at the diet. If it's a causative factor, I have found that it is at least 25%, maybe up to 33%, and in some cases probably more of our results. I've mentioned it before, but we have an 85 to 90% success rate with turning around condition such as peripheral neuropathy. So I hope this has been helpful. Look towards inflammation. There's plenty of books out there on it. You can Google it. If you'd like to consult with me, pick up the phone, call. The number here is 434-977-5433. You can hit reply to this. You can email me. You can ask questions. I would be happy to give you a consultation on the phone. I won't even charge you to see if I really think I can help you out. Do something. You know you need to do something about this. Are the drugs really going to solve your problem, or is it just going to cause other problems called side effects? Think about it. We have an 80 to 95% success rate. Call our office. Let's see if we can help you out today.